Avascular necrosis. The definition of avascular necrosis is the death of the bone due to loss of blood supply. Avascular necrosis is also called as osteonecrosis. So let's talk about the cause of avascular necrosis. You can remember the cause by a mnemonic, which is sclera. S for steroids, C for Casson's disease, LE for lupus erythematosus, R for radiations, and A for alcoholism. The other causes are fractures, dislocation, and obesity. The pathology of avascular necrosis. Whenever there is avascular necrosis, the avascular bone does not take part in repairing of the fractured bone. Therefore, the bones become weak and susceptible to external forces, therefore resulting in osteoarthritic changes. Osteoarthritis refers to a type of inflammation of the joints because of degeneration of articular cartilage. Now, the most common bones affected or the most common sites for avascular necrosis. First, we have the scaphoid bone. The two major blood vessels which supply the scaphoid bone are the volar branch and the dorsal branch of the radial artery. The volar branch supplies 20 to 30% of the blood and the dorsal branch supplies about 80% of the blood. Next, we have the head of the femur. Avascular necrosis of the head of the femur is usually seen whenever there is a fracture of the neck of the femur. The neck of the femur is supplied by the medial and the lateral circumflex artery. Next, we have the body of the talus. In the body of the talus, it is supplied by the anterior and the posterior tibial artery and the peroneal artery. Important thing to remember in avascular necrosis is avascular necrosis of the scaphoid bone is also called as the Preser's disease. Avascular necrosis of the head of femur is called as the Chandler's disease. Now, the clinical features of avascular necrosis. Initially, in the initial stages, it is asymptomatic. In the later stages, you see pain, tenderness, swelling, joint deformity, limping, especially affecting the hip joint. In the advanced stages, you see osteoarthritis. Complications of avascular necrosis, as discussed earlier, is osteoarthritis. Other disorders associated with avascular necrosis is Perthes disease, also called as the Lake-Calves-Perthes disease. Medical management includes administration of the bisphosphonate drugs, and surgical management is revascularization, that is by using bone grafts. Secondly, excision of the avascular segment followed by prosthetic replacement. Thirdly, total joint replacement. An important note over here is delay weight bearing on the necrotic bone until revascularization is seen, and revascularization usually takes about 6 to 8 months. Diagnosis of avascular necrosis. The bone scan shows a cold area. MRI provides the best sensitivity. It shows the presence of a crescent sign. X-ray shows a dense area and sclerosis. Dense means it appears more whiter and sclerosis means it appears patchy.